Hi, my name is Jerry Hesch, and we have an interesting case here today, and this is the title. The title is Sacroiliac Joint, Novel Hesch Pattern. And I use my name because this is a pattern that I have discovered and developed a treatment for it and a description of the whole body response when a person has this pattern. The pattern is named posterior sacrum. In this client, we have some advanced concepts on this pattern, such that she has unusual distal compensation. This is part one. And if you are familiar with the pattern named posterior sacrum or posterior glide fixation of the sacrum, that's good. If you're unfamiliar, there are other YouTube videos that describe that pattern. In the past, I've referred to it as posterior glide fixation of the sacrum. And in the workbook and in the basic and intermediate workshop, we cover that pattern and we describe how the body compensates up in the thoracic spine, rib cage, and upper cervical. However, with this client, I'm titling this Advanced Concepts because she does have some very unique distal compensations. When I describe a posterior glide of the sacrum, I describe a pattern in which the sacrum appears to be posterior. When you come off the PSIS into the sulcus, in a normative sacrum, you do fall downward on each side. With this presentation and with any presentation that fits this pattern, you will actually climb up onto the sacrum. Now, it's not based only on how things appear, but also based on a complete restriction of passive mobility throughout the pelvis. Because when the sacrum moves posteriorly, it wedges the sacroiliac joints on both sides, because the sacrum is essentially tapered much in line with the tapering of the ilium. And it's tapered, on both sides such that it's wider in the front. So when sacrum comes posteriorly, which is completely unphysiological, it wedges the pelvis bilaterally, and there's no passive motion available. Whereas with a normative joint, you would be able to take up the slack through that structure and then impart some spring mobility. Now, I'm sure you're seeing the spring on the table. In a clinical situation, we would take up the slack through the patient, through the table, etc. This pattern is not described in the body of literature, and I think we will just move right into describing the client. Cindy, would you feel comfortable? We're not going to film your face, but would you be comfortable telling us how you feel that you got that posterior sacrum?
Absolutely.
Go ahead and talk, and we'll just film on the anatomy here.
Oh, okay.
So go ahead and just talk.
Just okay.
Sure.
I went in to get some work done by a physical therapist. I had been in a car accident with my foot on the brake and sitting at a stoplight, and after that point, I couldn't do my walking anymore, and I had a lot of restricted motion on the right leg and a lot of jamming feeling on the right leg. Went to a physical therapist for a while, and she did help with the rotated sacrum, she felt at the point. But down the road, she put me on a device called a sacral wedgie. And it was after that, my sacrum the very next day actually made a huge clunking sound. And from that point forward, I always felt like when I was on the ground, I was laying on top of my sacrum and versus my buttocks.
Okay, so prior to that treatment, when you laid on your back, you felt like you weren't aware of your sacrum.
I was not aware of my sacrum.
Yeah, okay.
Until that point. So, and it has just been a downhill progression in trying to find a fix for this and get some help.
What fascinates me is that you would think that laying on your back on this device, you would assume an anterior force on the sacrum. The body weight would push posteriorly, but the sacrum sitting against this device, this curved device.
Right.
So it's a paradoxical response.
Well, and actually when I left the physical therapist on that day that she used the sacral wedgie, by the time I got to my vehicle, both my feet were burning.
Interesting.
And I had not had any of that prior to that.
Yes, yeah. There's two mechanisms. This is the first time I've heard this mechanism. I've never heard of someone being injured with this device, so this is not a film that is a negative statement about the sacral wedgie. I feel neutral about it. This is the first time I've ever heard someone being hurt on it, so I wouldn't predict that this would happen. In fact, it seems like your body did the opposite. So there's a big mystery here.
Right.
I had another point, and I forgot it. Okay, but if you were laying on your back here, okay, and you have your body weight here pushing backwards, it just seems like more of a forward. I know, I was saying that most people who get a posterior glide fixation of the sacrum, it happens with a fall on their buttocks, and I believe that the SI just gaps slightly there, but the upper body weight flexes, the trunk forward flexes, and it pushes a posterior force through the sacral body of S1, and I can image that being at about a 45 degree. If you image someone landing on their buttock and a little bit backwards, and then the trunk flexes, I can image the force being at about a 45, which would be in line with the joint to glide it backwards.
I see. But I have had no fall. I've had no fall at all.
The only other technique is when someone delivers a big baby and it pushes that posterior. At that time, they're much more vulnerable.
Absolutely. Sure,
so,
I can see that.
Interesting. Let's have you lay on the table. And Karen, we're not going to film her face, so if you would just focus on the rest of her body. Okay, go ahead and lie on your back.
On my back?
Yeah.